Good day, dear learners. We are now on to Module 5M for our midterms coverage, which is the endocrine system. For this presentation or for this lecture, I have made a two-part video. For this first part, we are going to talk about just the endocrine system, not including the disorders or the imbalances or the hyper or hypofunction of each gland. Now, for the care of patients with hormonal disturbance, our objectives would include to review the hypothalamic pituitary endocrine mechanism, explain the following conditions of the hypothalamus, pituitary gland, thyroid gland, parathyroid gland, adrenal glands, and the gonads. We are to specifically also include pathophysiology, its manifestations, the diagnostic studies, and of course, now, for the endocrine system, it plays a very important part, integral part, in the regulation of the body's internal environment. It regulates growth, reproduction, metabolism, fluid and electrolyte balance, and gender differentiation through hormones. Now, we have major organs or major glands in the endocrine system. We have the pituitary gland, thyroid gland, parathyroid gland, adrenal glands, pancreas, and the gonads. These glands would be our focus on the disorders or conditions later on. Now we start the pituitary gland. The pituitary gland is considered as the master gland. It basically has two parts. The anterior pituitary, or we refer them as the adenohypophysis, and the posterior pituitary, which is the neurohypophysis. It is located in the skull beneath the hypothalamus of the brain. It is called as your master gland because its hormones regulate many body functions, and its anterior pituitary is composed of a glandular tissue, whereas the posterior is actually an extension of the hypothalamus. So here are some of the hormones being secreted by the anterior pituitary gland. For the adenohypophysis or the anterior pituitary has several types of endocrine cells and secretes at least 6 major hormones. The somatotropic cells, which secretes growth hormones, which stimulates growth of the body by signaling cells to increase protein production and by stimulating the epiphyseal plates of the long bones. We also have the lactotropic cells, or which releases your prolactin or your PRL, which stimulates milk production. We also have the thyrotropic cells, which secretes the thyroid stimulating hormone, which stimulates the release and synthesis of the thyroid hormones. We also have the corticotropic cells, which releases and stimulates the adrenocorticotropic hormone, or your ACTH, which stimulates the release of your glucocorticoids from the adrenal cortex. And we also have the gonadotropic cells, which releases FSH and your LH, your follicle stimulating hormone, and your luteinizing hormone, which stimulates your ovaries and the testes. For women, for FSH, it stimulates the development of ovarian follicles and induces the secretion of estrogenic female sex hormones, including levels of LH, increasing the levels of LH which works together with FSH that leads to ovulation and the formation of the corpus luteum from the ovarian follicle. In man, FSH is involved in the development and maturation of sperm. LH, or interstitial cell stimulating hormone in man, ICSH, stimulates the interstitial cells of the testes to produce male sex hormones. On to the posterior pituitary gland, we only have two. It's your antidiuretic hormone, or your vasopressin, and your oxytocin. The antidiuretic hormone decreases urine production, and this causes the renal tubules to reabsorb water from the urine and return it to the circulating blood volume. And for oxytocin, it stimulates your myometrium of the uterus to contract during labor, and it also induces milk ejection from the breast. So it induces contraction of the smooth muscles in the reproductive organ. The thyroid gland and the parathyroid gland. The thyroid gland is a butterfly-shaped gland. It is anterior to the upper part of the trachea and just inferior to the larynx. It has two lobes connected by a structure called isthmus, and it secretes your thyroid hormones T4, thyroxine, T3, triiodothyronine, and calcitonin. TH secretion is initiated by the release of the thyroid stimulating hormone by the pituitary gland and is dependent on the adequate supply of iodine. The thyroid gland also secretes calcitonin, a hormone that decreases excessive levels of calcium in the body by slowing calcium releasing activity of bone cells, which serves as marker for sepsis and is believed to be a mediator of inflammatory responses. The primary role of your thyroid gland is to increase metabolism. If thyroid gland is totally removed and thyroid hormone is replaced, calcium homeostasis and bone density remains relatively unchanged without replacing calcitonin. Parathyroid gland, on the other hand, are embedded on the posterior surface of the lobes of the thyroid gland. They secrete the parathyroid hormone or the parath hormone, which controls calcium and phosphate. When serum calcium level falls, PTH secretion increases, and PTH also increases phosphate metabolism. It acts primarily by increasing renal excretion of phosphate in the urine by decreasing the excretion of calcium and increasing bone reabsorption. Normal levels of vitamin D are necessary for parathyroid hormones to exert its effect on bones and the kidneys. Next is your adrenal glands. Your adrenal glands are pyramid-shaped organs that sit on top of the kidneys. Each gland consists of two parts, which are distinct organs, the inner medulla and an outer cortex. The adrenal medulla produces two hormones called catecholamines. They are your adrenaline or epinephrine and your noradrenaline or norepinephrine. These hormones are similar to substances released by the sympathetic nervous system and thus not essential to life. Adrenaline increases blood glucose levels and stimulates the release of your adrenocorticotropic hormone from the pituitary. ACTH stimulates then the adrenal cortex to release glucocorticoids. Adrenaline also increases the heart rate and force of cardiac contractions, constrict blood vessels in the skin, mucous membranes, and kidneys. It also dilates blood vessels in the skeletal muscles, coronary arteries, and pulmonary arteries. Noradrenaline, on the other hand, increases both heart rate and the force of cardiac contractions. It also causes vasoconstriction of blood vessels throughout the body. Now, your cortex secretes several hormones, which is all corticosteroids rather, and they are classified into two groups, mineralocorticoids and glucocorticoids. An enzyme named renin primarily controls the release of mineralocorticoids. When decreased blood pressure, if there's a decreased blood pressure and sodium is detected, cells in the kidneys release renin to act on angiotensin, and with angiotensin, it then initiates the process of your RAS or your renin-angiotensin-aldosterone system. If you have aldosterone already, It prompts the distal tubules to increase reabsorption of water into the circulating blood volume to increase blood pressure. Glucocorticoids, on the other hand, include cortisol and cortisol. These hormones affect carbohydrate metabolism by regulating glucose use in body tissues, mobilizing fatty acids from fatty tissues, and shifting the source of energy from muscle cells to glucose to fatty acids. And excess glucocorticoids in the body depresses inflammatory responses and inhibits the effectiveness of the immune system. Next is your pancreas. Your pancreas, you have a separate rather module which was discussed with Miss Perez, I believe, for 4M. So of course, with your it has an endocrine and an exocrine function. This is located behind the stomach, between the spleen and the duodenum. Endocrine function of which, because it produces hormones. Exocrine, on the other hand, function, they produce also digestive enzymes. Endocrine cells are clustered in bodies called the pancreatic islets, which is scattered throughout the gland, and it has four different cell types. You have the alpha cells, which produces glucagon, beta cells, which produces insulin, delta cells, which secretes somatostatin, F cells, which is believed to inhibit exocrine activity of the pancreas. And lastly, we have the gonads. Gonads are the testes in man and in ovaries in women. These organs are the primary source of steroid sex hormones in the body, which is important in regulating body growth and promoting the onset of puberty. In men, androgens or testosterone they are produced by the testes to maintain reproductive functioning and secondary sex characteristic. They also promote the production of sperm. In women, on the other hand, the ovaries secrete estrogen and progesterone to maintain reproductive functioning and secondary sex characteristic. Progesterone also promotes the lining of the uterus to prepare for implantation of a fertilized womb. Now, for hormones, what is its function in the endocrine system? Well, hormones are considered as our chemical messengers secreted by the endocrine organs and is transported throughout the body. These hormones exert their action on a specific cells or target cells, and they do not cause reactions directly but rather regulate tissue responses. They may produce generalized effect or localized effect. We have three mechanisms for hormone release. We have the humoral, neural, and hormonal. For humoral, endocrine glands releases hormones in direct response to changing levels of ions or nutrients. The hypothalamus secretes hormones. It stimulates the anterior pituitary gland to secrete hormones that stimulate other endocrine glands to secrete a hormone. For neural, we have nerve fibers stimulate hormonal release. The preganglionic sympathetic nervous system fiber stimulates the adrenal medulla cells to secrete your catecholamines or catecholamines. For hormonal, glands release hormones in response to other hormones. Example would be capillary blood flow contains low concentration of calcium, which will then stimulate the secretion of your parathyroid hormone. We also have a feedback mechanism. This is to regulate hormone concentration in the bloodstream and helps in the regulation of many biologic processes. So with stimulus, we have, if there is a change in the homeostatic environment, it will give signal which will be sent to the CNS, and of course a response which was from the CNS, and it produces an effect, and the body now returns to its homeostasis. For feedback mechanism, we have two: negative feedback, which is the common one, the usual mechanism involved, but we also have the positive feedback mechanism. For negative feedback mechanism, examples would be if there's an increasing levels of substance, hormones is being inhibited, its synthesis and secretion is being inhibited, and if there's a decreased levels of if a particular substance, then the synthesis and secretion of a hormone will be stimulated. So, for example, if there's a decreased calcium levels, then the parathyroid hormone increases its secretion in the intestine, in the bones, and in the kidneys. So sensors in the endocrine system detects these changes in the hormone levels and adjust the level of hormone secretion to maintain homeostasis. So they do this by the negative feedback system or the positive feedback system. For positive feedback system, increasing levels of one hormone, which causes another gland to release a hormone. An example would be a release of estradiol, which is a female ovarian hormone, during the follicular stage of your menstrual cycle. In turn, also stimulates the production of your follicle-stimulating hormone in the anterior pituitary gland. That's a positive feedback mechanism. Now, how do we assess endocrine function? It's important that we know how so that we can determine if there's an abnormality. So the function of the endocrine system is, endocrine gland rather, is assessed by the findings from your interview, health assessment. Health assessment interview provides the healthcare provider a subjective data, while your physical assessment and your diagnostic tests provides you with objective data. Now, hormones they affect many, or all body tissues and organs, and manifestations of dysfunctions are often non-specific, making the assessment sometimes more difficult. Now, see you with our next, the part 2 of this discussion for the hypo and hyperfunction of each gland. Thank you very much. God bless.